Chronic fatigue syndrome is a constant feeling of fatigue and overwork, a decline in strength that does not pass even after a long rest. The main cause of the syndrome is considered to be long-term psycho-emotional stress on the human nervous system. Chronic fatigue syndrome is a disease of civilized countries. At risk are residents of megacities, especially people whose work is associated with increased responsibility. These include teachers, doctors, firefighters, entrepreneurs, and people in high positions. However, the syndrome of chronic fatigue can also appear in people of other professions. No one is immune from this unpleasant disease. Poor sanitary and environmental conditions, chronic diseases, viral infections, and an unbalanced emotional and intellectual load, all this increases the chances of developing chronic fatigue syndrome even at a young age. The occurrence of chronic fatigue syndrome is associated with the development of a specific neurosis of the central regulatory centers of the autonomic nervous system. If this syndrome is left untreated, it can develop into depression, as well as cause infectious and allergic diseases. Normally, any severe fatigue passes after a full sleep and rest. If a person has had a good night's sleep and a good meal, but continues to feel sluggish and tired, which prevents him from performing his usual tasks, this is rather a pathological condition. The main symptom of chronic fatigue is causeless constant fatigue, which reduces performance several times. However, this also affects the psycho-emotional well-being of a person. It significantly restricts daily life and interferes with communication, because the moral resources are no longer enough even for loved ones. In addition, with chronic fatigue, a headache occurs, memory loss, insomnia, nausea, and more. Due to the variety of symptoms, the disease is quite difficult to diagnose. Chronic weakness and fatigue manifest themselves gradually, and a person may not realize for a long time how many opportunities have been lost until he tries to compare his performance in the old days with that of others, what is now. Unfortunately, people often attribute the decline of strength to age or life circumstances, thus ignoring the symptoms and making the situation worse. It is important to pay attention to the following signs of chronic fatigue in time. Constant loss of strength and reduced performance. Rapid fatigue. Mood swings. Another symptom of chronic fatigue can be mood swings, from complete apathy to outbursts of anger. Sleep disorders. Drowsiness, insomnia, not bringing cheerfulness to the surface or intermittent sleep. Headaches that differ from those that were before, in intensity, nature, or duration. Problems with memory and thinking. Impaired concentration, mood deterioration, difficulties with remembering information, irritability. Decreased immunity, for example, frequent sore throat, exacerbation of chronic diseases. Increased body temperature. Enlargement of different groups of lymph nodes. Cervical, axillary or other. The first of these symptoms is the key, while the others complete the picture. In advanced cases, chronic fatigue not only reduces the quality of life, but can also provoke life-threatening situations. For example, a sharp deterioration in concentration or drowsiness is a common cause of accidents. That is why it is important to start treatment in time for chronic fatigue syndrome.